So I was asking you about your work, your daily work as a plastic surgeon.
Today, as you know, office procedures in plastic surgery are very popular. For example, people like injectables such as the Botox family or fillers such as the hyaluronic acid family. And we also do some non-invasive procedures like chemical peels, etc., in the office. But as far as my practice outside the office in the hospitals are concerned, I go to 9 hospitals in New Jersey. So I'm on call at 9 different hospitals. It's busy. It's very busy.
I remember last year your lecture. You were talking about Botox and the doll's face and feelings.
Yes, thank you.
It's very common that people come to your office for that reason.
Yes, it's very, very popular now in the States, as I'm sure it is here. We have several neuromodulators, like the Botox family, which can relax the muscles of the forehead, of the orbicularis oculi. We have several fillers, which can fill in wrinkles and divots in the lower part of the face. And we also have some non-invasive procedures like thermy, which is radio frequency, and some laser procedures and chemical peels. Very, very popular today in plastic surgery and in other fields of medicine as well.
We also have these problems about trauma that you told us, the people that had were bitten by dogs or had accidents. This is very common in our country. And I was talking with our dean, Dr. Zúñiga. He told us that there was only one face transplant in Peru, only one, and for a patient that was burned. Do you see these cases in your practice that you have to reconstruct a great part of the face?
Well, we see a number of reconstructive type cases. For the most part, most trauma, if handled primarily in the emergency room, is simple and takes a year to 18 months to heal, and very seldom do we need to reconstruct these people. It's only in very severe injuries that the case might be taken to a trauma center where, for example, a whole ear is bitten off or a whole nose is bitten off by the dog. Those are cases that are rare, but they're taken to the big centers around New Jersey, the trauma centers where they can do microsurgery or some bigger cases. But more often than not, the trauma cases in plastic surgery can be fairly straightforward and can be repaired in a fairly straightforward manner.
We are here in Huancayo and in most parts of Peru, most medical centers are run by general practitioners. So they receive the patient with the trauma and they don't know too much about surgery. Do you have some counseling? What can they do not to aggravate the lesions? Maybe they have to suture. How can they preserve the skin better?
Well, as a matter of fact, my lecture on Friday is on that topic. I hope the students will enjoy it. It's a lecture on wound healing and scars. And in the lecture, I talk about how to minimize a scar deformity, both at the time of injury, when the primary physician takes care of the wound, whether he closes it in layers or uses sutures that are tiny, or reapproximates the vermilion border correctly, and then later on what we do as the wound is healing in order to minimize the redness, minimize the bumpiness, minimize the various deformities that can occur as the wound heals. In my opinion, medicine was and still is one of the most rewarding professions in the world. And if you have the stamina, the energy, and of course the intelligence to go on ahead through medical school, through residency, and then perhaps through fellowships like I did, you will never regret it. And I enjoy every day that I go to work and take care of patients and take care of problems in medicine. And I enjoy working with my colleagues in medicine. That's another thing that students learn to enjoy in medicine. There's a lot of camaraderie. which doesn't exist in other professions. If you're a librarian, you sit in the library alone all day. In medicine, we talk to our colleagues about patients. You talk to the patients. You talk to the family. It's a very, very rewarding profession. And I would encourage everyone, male and female, to consider some of the more difficult specialties like surgery, plastic surgery, pediatric surgery, etc.